It was devastating to know that I'm actually going to die.
Sue Baker's heart began to fail in 2019. After 7 trips to the hospital near her home in southeast Georgia, she was transferred to Mayo Clinic, where she met Dr. Parag Patel, a transplant cardiologist.
She only had 3 to 6 months to live, and we needed to act fast.
Sue had 2 options: hospice or have a heart pump known as a left ventricular assist device, or LVAD, implanted. Sue hoped the LVAD could be a bridge to a heart transplant. However, in 2023, years of medically implanted devices and other factors produced a high antibody count. That meant her body would attack what it believed were foreign objects. Transplant was no longer likely.
Processing, it was devastating.
Her care team wasn't giving up. They learned about an approach tested on the other side of the country that would make Sue a recipient of 2 organs and become a donor herself.
HALT-D is heart after liver transplant with a domino liver. We take the liver of the patient who's receiving the heart after liver, and we take that liver and we put it into another recipient so that we do not waste an organ.
While Sue's liver was healthy, she needed a new one that could absorb the antibodies from a transplanted heart and reduce her risk of rejection. The procedure had never been done on someone with a heart pump.
If somebody doesn't let you try, you're not going to know, so I agreed to try this out.
Sue spent months in the hospital waiting for a match and bonding with others in the unit, earning the nickname Mama Sue.
We become like a real close family. That was a lot of healing and helpfulness.
In September 2024, the transplant was a success.
Not only is she benefiting from the gift of a donor and a donor family from receiving a heart and liver, but she's actually donating her liver to another recipient.
Sue is getting stronger and finds motivation to live in honor of her donor.
I would love to thank and meet the family. I'm not going to sit back and do nothing. That person will always be special.
For the Mayo Clinic News Network, I'm Alex Ositis.